Upgrade 4.1 ICD Diagnosis Event Type. This is a worked example using diagnosis event type as an indicator variable. The event type is ICD diagnosis. Using a single event type, you can now find a patient with a diagnosis occurring in any of four events: an inpatient admission, an outpatient visit, an emergency department visit focused on the ED triage daytime, or an ambulatory surgery visit. Warning: the ICD diagnosis event. Hospitalization diagnoses are only recognized on the date of admission. So if you have an interval of time that captures the date of admission, you will get the diagnoses. If you have an interval of time that captures only the date of discharge, you will not get the diagnoses from that hospitalization. Prior to the date of admission, hospitalization diagnoses are ignored. The payday is the date of admission. You may have earned your salary over the course of the week before, but you only realize your salary on the date of admission. Similarly, the ED encounter type is based on the date of ED triage. If you capture the date time of ED triage, you'll capture the diagnoses for that ED event. So let's take a look in the old days of how you actually tried to collect all these diagnoses. In the old days, you would have an index event that would be made up of three possibilities: either the inpatient admission, the ED triage, or the outpatient visit. In fact, you could also have ambulatory surgery. And if you asked for the earliest diagnoses of these three possibilities, you would get the earliest diagnosis. Notice, inpatient admission, the hospitalization is focused on the admit date time, and ED is focused on the ED triage. But you would need three lines to capture the diagnoses. Now, in one line, you're able to get all those diagnoses. In one line, you're able to say, I want to get the ICD diagnosis that is, for example, epistaxis. ICD diagnosis has an attribute which is called an encounter type. And when you go to that attribute, you can choose, I want to include diagnoses from ambulatory surgery. I want to include them from an ER visit that is focused on the ED triage time. I want to include them on an inpatient admission focused on the inpatient date time. I want to focus it on the outpatient visit. And once you build your set, you can use that set to collect diagnoses only on that encounter type. Let's look at the output of an event collection built on an ICD diagnosis event type. You'll notice we're building an event collection using all. We're going to look at January 15th, 2015. So the first bit of business is to find a diagnosis with a new event definition type. We're going to make a new event based on the ICD diagnosis. We're going to choose ICD diagnosis. I'm going to rename this diagnosis as well. A condition can be added to the definition if we want to. And we'll see that the condition that can be added can be a diagnosis type, an encounter type, which would be ED or outpatient or inpatient, a facility such as Moses or Weiler, and an ICD diagnosis such as HIV. We're not going to choose any of these, and we're going to leave it just as a plain definition. We're going to update and close, and you'll see that the event type is an ICD diagnosis. We're going to set the duration definition to be January 15th, 2016 to January 16, 2016. We'll update and close, and then we will build. And you'll see that in a single day, January 15th, 2016, there have been 25,199 diagnoses in the inpatient, the outpatient, the ED, in this case ambulatory surgery as well, because we haven't built any restriction. So let's browse this collection. Check off all the different options on your browse form. You get a spreadsheet, and you can see that a single row for each diagnosis. In this case, we have an admission here, an inpatient admission for patient 1641, lots of rows. Diagnoses are admitting, primary, and secondary. Primary is the primary reason you're being hospitalized. Admitting is presumably the admitting diagnosis, but we don't really trust it. And secondary is everything else. You can see that outpatient visits do not have a diagnosis type. Although, in fact, they do have a diagnosis position of 1, and 1 presumably is the primary diagnosis. You see 2 1s here, but they belong to 2 separate patients. So position 1 in diagnosis in the outpatient is the primary diagnosis. They don't have a diagnosis type the way inpatient does. And here are those diagnoses. And here is present on admission. If you want to build a pivot table, it's easy enough to do in Excel. You insert a pivot, and now you're able to look at all the diagnoses. Here are all those diagnoses. You bring them over to the sum. If you want to sort them in terms of count by the largest to smallest, you sort largest to smallest. Here they are. If you want to break down the location, go to encounter type, you put it in the filter field, and now you can say I want to look at all the inpatients and see the most common diagnosis. It's still essential hypertension, but then we might want to find out diagnosis type. Put that in the filter as well. And we might say diagnosis type is only going to be primary. And now we see this is the most common primary diagnosis on this one day. And everything else is spread around a whole bunch of other primary diagnoses. Anyway, you can have a lot of fun playing with this. What's important to note are your attributes. Diagnosis as an event type is fast. It allows you to make a single condition line to capture a whole number of different event types, whether they be inpatient, outpatient, ED, or ambulatory surgery. But there are specific attributes you cannot get. In the inpatient event, you have a whole bunch of attributes: length of stay, admitting physician, DRG, APR-DRG, referral location. Those are important variables. You can't get that with a diagnosis event. So there's a trade-off, and you have to know when to use it. But it's a very fast and efficient way to get diagnoses of any particular site or group of sites. Now let's work an interesting problem using the new event type ICD diagnosis. Here's the challenge problem. For a cohort of patients with hepatitis C, we're going to use this as hepatitis C antibody positive from January of 2010 to May 2016. Now, why am I using a laboratory test instead of an ICD diagnosis? Let's stop for a minute on this. Well, people are not always careful about recording hepatitis C as a diagnosis, but the laboratory test is relatively straightforward. So it's better to build this cohort on the laboratory test of hepatitis C antibody positive to get greater sensitivity. Now, we ultimately want to build a spreadsheet that will include the usual demographics: age, race, gender, ethnicity, language, SES neighborhood. We'll include an indicator variable for the presence of an HIV diagnosis. Now, why are we using ICD diagnosis for HIV diagnosis? Why don't we use a lab test? As you may know, there are many lab tests for HIV, and they've changed over the years. So it's a very complex thing to use those lab tests. You can, but it's many, many condition lines, whereas diagnosis event is relatively simple. So we're going to use the ICD diagnosis event to be the indicator for the presence of HIV in this spreadsheet. Now, when you're building your hepatitis C infected cohort, our options are, of course, again, the diagnosis of hepatitis C, and as I said, we're not going to do that, or the laboratory test, in which there are really two laboratory tests in the data warehouse. There's something called hepatitis C virus antibody, and there's something called HCV antibody EIA. And you have to look under both of these notions in order to get hepatitis C antibody positive or reactive. Now, how might you find the names for this test if you did not know them? Well, you might call somebody up. Or you'd search the laboratory pathology compendium on the Montefiore compendium. And then after you have the different names from the compendium, you'd search in Looking Glass to find whether those are represented in the laboratory data of Looking Glass. Let's actually do this exercise right now. If you go to HTTP intranet, it opens the Montefiore intranet, and this is what you find. You can click on the clinical department. You find pathology. You click on that. And then you see something called the test compendium and search. You click on that. And then you type in the search hepatitis C, and then click on go. And what then opens up is a compendium, and it gives you all the different tests that are available on hepatitis C. You see relatively quickly there's something called HCV. That's a good thing to look for. HCV antibody EIA, and hepatitis C antibody is a synonym. So these are two good things to search on, HCV and hepatitis C. Now we'll go into Looking Glass, and under Help, Search Event and Attributes, we covered this last time. You'll type in HCV, hit Go, and you'll see under Lab Test Type something called HCV antibody EIA. This is one of those things that you're going to need to search on to look for positive or reactive. And you know positive or reactive because you actually do a run on this over that time period, and you take a look and you see that there are things that are positive, some that are reactive, and some that are C node, that basically have negative results. That's HCV. We type in hepatitis C, and again we see something called hepatitis C virus antibody, and that's going to be the other way it's been designated over this time period. So now we're going to go into Study Designer. I've already built this so we can see it quickly, and I'll just show you the pieces of it. We have our group, and first we have our people who are hepatitis C antibody group numeric positive, and I'll tell you in a moment why we had to call it that. This is a group of patients who either had hepatitis C antibody positive or EIA positive. Let's see how I built it. You click on that. You go to the triple button. This will now open, although you're in Study Designer, it'll open a window into Event Canvas, as you can see. And now you see that I had built a cohort, which is the earliest group of patients in the period of time of January 2010 to May of 2016 who had something called a group numeric positive hepatitis C antibody. Let's see what that event type actually was that I had to build. I'm going to edit it. Here's my cohort. Again, here is the GUI editor. We're going to open up the event type. And you see the event type was a lab test, something called group numeric labs, hepatitis C antibody, and a subgroup that had the categoric lab value equal to positive or categoric lab value equal to reactive. Let's take a look at what the group numeric lab actually was. We're editing this line. It opened group numeric labs. Let's see what I did. This is a laboratory set called group numeric lab set. We covered this last time. and we found HCV antibody EIA and hepatitis C virus antibody. These were the two that I included. And that made my group numeric lab. So any lab test that's either called HCV EIA or hepatitis C antibody will be included. And I want to require that the result was, we're going to edit this, we created a set that either had a categoric lab value positive or a categoric lab value reactive. That's the construction of my cohort. I'm going to go back to my study designer. That was my hepatitis C group. And in the study designer, I have what's called my list method. My list method is in the advanced mode. And in my advanced mode, I brought over already my demographics, race, SES, age and index, and I've added a new analysis definition, which is called HIV diagnosed in 10 years around. So I'm going to have a list that's going to have these variables, and it's going to have this thing called HIV diagnosed in 10 years around. Let's look at that. Let's open it up and see what I had built, and it's my analysis definition. You can see my analysis definition is earliest, so it's a singularity. Earliest HIV diagnosis, 0 to 3,650 days after the cohort collection date. So I'm looking for the diagnosis within 10 years after the HCV was diagnosed. I could have made it around. That might have been better, but I did after in this case. Let's edit it. Here's diagnosis HIV, 0 to 3,650 days after the cohort collection, which is the hepatitis C. I'm going to modify the event so you can see it. And you can see I had an ICD diagnosis event, which I named diagnosis HIV, and I had a condition line, which was ICD diagnosis in set user HIV disease. Let's look at this and see what this set was. It was an ICD diagnosis of HIV disease, and HIV disease is any of these HIV conditions. Specific conditions, HIV malignant neoplasm, and the rest. So I had this set for ICD diagnoses that limited my ICD diagnosis to the presence of HIV disease. So I'm looking for the presence of HIV disease 0 to 3,650 days after the cohort collection date. That was after the hepatitis C antibody was found. I'm going to go back to my study. Now I have an AD that will fire positive when it finds a diagnosis of HIV. Okay? It will find that diagnosis for HIV. And I have to choose what elements for this outcome I'm going to find. Notice what I have here is I have the group, which is all focused on the hepatitis C virus antibody. And I brought over the demographics already. But if I want to get the outcome, which is HIV, I have to click on the outcome button. Note also, I have wide view, because I'm going to make a spreadsheet where every patient is represented only once. So I must make sure that my outcome is a singularity. Let's hit outcome and see what I can choose. Well, I'm going to choose count. Since it's earliest, the count will either be a 0 or it'll be a 1. It's a singularity. That is, if somebody has HIV as a diagnosis after the HCV, after the hepatitis C, you'll have a 1 there. And if you don't, it'll be a 0. I'm going to maximize the list method so I can work with it. I want to bring over count. I want to bring over facility. And I actually want to bring over the actual ICD diagnosis. You know, what form of HIV did I have there? facility. Where was the diagnosis made? And what does it count? I'm going to drag it over. And you can see as I'm dragging these three things over here. And now I have all my demographics, and I have for my outcome the count, the facility, and diagnosis. And now I will have a spreadsheet of all the HCV patients. Each one will have a row, and I will know whether they did or did not have HIV after their HCV diagnosis. Left click on the list maximizer minimizer. It's a toggle switch. Shrinks down, and I'm ready to run my spreadsheet. And the results show up in the spreadsheet. And here's the data. And you can see here the lab test value is positive or reactive in terms of the hepatitis C. The HCV antibody EIA and hepatitis C virus antibody that is being reported as positive or reactive. Here is the count for the presence of an HIV diagnosis, 1 or 0. And next to it is the actual HIV diagnosis type that you had. Asymptomatic, human immunodeficiency virus disease. Here is the hospital location or family center, health center location, and facility. And like anything else, you're now in an Excel spreadsheet, so you can build a pivot. And we're going to build a pivot around the count first. And I'm going to build a pivot. I'm going to get the number, the count of those patients. And strangely enough, I have only 1492. I would warn you to always find out what is Excel doing. You can see here by hovering over the number, it's doing a sum of the value of count. So we know there are 1492 people with a count of 1, but we don't have only 0 people who are not HIV positive. I'm going to highlight this. You right click. Value of field setting is not going to be sum, it's going to be count, so you should be choosing. And there are 8,932 patients who are not HIV positive and 1,492 who are HIV positive. So out of the total 10,424 patients in this 5-year window, 1,492 are HIV positive. You can hover over that, right click, and you can show the values as percent of the column total, and it shows you that 14% are HIV positive. Now you can have some additional fun by taking a look to see where these diagnoses, what were these diagnoses of the HIV positives. So you carry down the diagnosis here. You can see that 10% carried 042, and smaller numbers carried the asymptomatic infection status, 3%. If you want to find out the facilities they were at, you just drag down facility. And now you can see where the first time the diagnosis was recorded after the hepatitis C virus infection was known. So you've seen now how to use the diagnosis event type in a very effective way. How to use it as an indicator variable for the presence of HIV that otherwise would have been very difficult to do because there are lots of HIV tests. And of course, as you know, it's much more likely that the diagnosis of HIV would be recorded than hepatitis C. For more information, see my book, Riddles in Accountable Healthcare, available at Amazon. also available as Kindle.